This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your heart is a big stadium full of fans doing the wave. To keep the rhythm perfect, everyone needs to stand up and sit down exactly on cue. But sometimes, electricity in the heart gets completely chaotic. Instead of a smooth wave, people start jumping up and down all over the place out of order. This creates a dangerous, chaotic heartbeat called Torsades de Pointes. If you look at it on a heart monitor, the electrical lines twist up and down like a piece of ribbon. It is a major medical emergency because when the heart is twisting and shaking like that, it can't pump blood to the brain. Here is how paramedics use magnesium to fix it right there in the back of the ambulance. How magnesium fixes the rhythm. Think of magnesium as the ultimate chill-out mineral for the heart. Inside your heart cells, there are tiny doors called channels. When the heart beats, electricity flows through these doors using minerals like calcium and potassium. In Torsades de Pointes, the cells are overexcited. Calcium keeps rushing inside the cells when it shouldn't, making them misfire and trigger extra chaotic beats. The shield effect. When a paramedic gives magnesium through an IV, it rushes to the heart and blocks those overactive calcium doors. The reset. By turning down the calcium, magnesium calms the electrical storm, stabilizes the heart cells, and lets the heart's natural pacemaker take control again to bring back a normal, steady rhythm. Why it matters in pre-hospital medicine. In an ambulance, paramedics have to act incredibly fast because torsades can quickly turn into a total cardiac arrest. Magnesium is a lifesaver in the field because it works fast, it goes straight into the bloodstream, and can calm the heart down in just a few minutes. It stops the trigger. Other standard heart medicines can actually make the specific twisted ribbon rhythm worse. Magnesium is one of the absolute best tools paramedics have to stop this exact type of chaos before arriving at the hospital. In ACLS, magnesium sulfate is not a drug used in every arrest or arrhythmia algorithm. Instead, it is the absolute drug of choice for one specific, lethal cardiac rhythm, Torsades de Pointes. Pulseless Torsades de Pointes, cardiac arrest. If a patient is in cardiac arrest, VFib or pulseless VTAC, and the monitor reveals Torsades de Pointes, a twisting, ribbon-like polymorphic VTAC, magnesium is integrated directly into the standard shock, epinephrine, amiodarone sequence. When to give: after the first or second shock, alongside or immediately following your primary antiarrhythmics, like amiodarone or lidocaine, if torsades is recognized. Dosing: 1 to 2 grams of magnesium sulfate diluted in 10 milliliters of dextrose D5W or normal saline. Administration: given as an IV or IO pushover 1 to 2 minutes. Torsades de Pointes with a pulse, tachycardia algorithm. If the patient is stable or unstable but still has a pulse, and the rhythm is identified as polymorphic VTAC associated with a prolonged QT interval, torsades. Dosing: 1 to 2 grams mixed in a 50 to 100 milliliter IV bag of D5W or normal saline. Administration: infused more slowly than the pulseless arrest dose, typically over 5 to 20 minutes. Note: if the patient becomes unstable, hypotension, altered mental status, signs of shock, immediately prepare for immediate synchronized cardioversion or unsynchronized defibrillation if the machine cannot track the polymorphic R waves.